Have you ever looked in the mirror in the morning and thought, oh my God, what's happening to me? Today on Dueling Doctors, we're tackling beauty issues from head to toe that everyone encounters. Wrinkles, thinning hair, and that not so flattering foot fungus. What's at the root of these problems? And more importantly, how can we conquer them? Different doctors from the world of holistic natural medicine and conventional Western medicine square off on how to put these beauty dilemmas to bed. Plus, you won't believe what's in your kitchen cupboard to stop your hair from falling out. It's holistic and natural versus conventional health experts with different opinions and one goal, to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of holistic, natural, and conventional Western medicine join us to debate and discuss the best ways to treat all sorts of ailments and illnesses. Let's get started by introducing our guests. On the naturopathic side of the equation, with an Ayurvedic training, is Dr. Karuna Subnani, and with a more Western conventional approach is plastic surgeon Dr. Shirley Madir. Welcome, both of you.
Thank you.
Our first topic off the beauty chart is wrinkles. Now, we know that fine lines and creases in our skin happen as we age because the skin loses elasticity. But other factors besides genetics can also exacerbate wrinkles, like the sun and smoking. So now we know what causes it. How can we minimize, prevent, and eliminate wrinkles? Each of our experts has up to 1 minute to present a treatment plan, and then each will have the opportunity to respond to the other. We flipped a coin before the show to see who would go first, and guess what? Dr. Madir, you are up first.
Thank you. Well, I am a plastic surgeon, and I am very traditionally...
And you're also my new best friend.
Absolutely. Jealous.
I'll give you a chance.
I am very Western trained, and I very much respect the natural route and the holistic approach because I certainly incorporate it as well. However, there's only so much that one can do when it comes to sagging and wrinkles and fine lines. So even though I definitely counsel my patients to do the best that they can from the inside out, and I believe beauty certainly comes from the inside out, I also believe that sometimes we need a little help from our friends, and that might involve a needle or a scalpel from time to time.
And what would be in that needle?
So, in those needles, in those very special needles that we call our friends, they're injectables for the most part, and they include anything from Botox, which acts on the muscles and helps to reduce...
So Botox, let's just say what it is, really. It's a toxin, botulinum toxin.
Yes, it is.
Synthetic form.
Natural,
but it paralyzes the muscles so that you cannot move that muscle. It doesn't affect the wrinkle, it's the muscles that cause the creases in the skin. Correct.
So the muscles are tethered to or obviously attached to the skin, and when muscles contract, then they pull on the skin in a certain way to create the dynamic
And this
wrinkle.
is not being absorbed, this is locally.
Botox is definitely, it acts locally within the muscle, absolutely, because the effect is local.
So we got Botox.
We got Botox.
For my wrinkles.
No, for the wrinkles, that's right, for the dynamic ones. And so for the other kinds of wrinkles or folds, then we have other injectables that are called fillers. And fillers are different from Botox because they're not toxins, and many of them are actually based on naturally occurring substances such as calcium and hyaluronic acid. And we use those fillers to plump up lines.
So basically we're talking, I always heard Botox above the eyes and fillers below. Well, so like the nasolabial fold,
that's
which
sort of
I don't really
have. You don't have any, right.
Do I need a consult?
No. So generally speaking, that's a good rule of thumb. However, a lot of practitioners, myself included, are very comfortable with using Botox below that area.
Ooh.
So you definitely can use Botox around, very saucy, very sexy.
Okay, I'm gonna ask you a question.
Yes.
What's wrong with a couple of wrinkles? You know, I'm just saying, you know, we age. We get to a certain point where I feel like I earned these wrinkles.
Absolutely.
And let's just face it. You're 50, you get Botox, you're not going to look 20.
This is true.
You're going to look like a 50-year-old who got Botox.
Or you may look like a better version of that 50-year-old. Aging is totally natural. It's completely normal, and one should embrace it. However, the degree to which you embrace that is completely subjective.
So you agree to embrace it kicking and screaming?
Yes, I'm not going down that easily.
Okay, all right. Dr. Sabdani, what do you think? Go ahead, spit it out. I see you, girl. You're like, ah. This is a chalkboard. My ears, dogs are barking outside.
So, of course, aging is natural, and we have to think about the fact that if we don't focus on what's going on inside, which, you know, few women will go straight to the Botox. I know that happens often. We may miss deeper health concerns that may be causing the wrinkles. So collagen obviously is the most important thing with wrinkles, and it's affected by sun, pollution, and free radical damage. So the first thing that I would do is make sure that the free radicals are taken care of.
Sure.
Prevent by reducing the smoking.
Yes.
Reducing the smoking.
Quitting it altogether.
No smoking.
Yeah,
Right.
but some of these New Yorkers sometimes can give you a hard time about that. So I'm just being a little politically
no
correct.
smoking.
He said it, not
No
me,
smoking.
right?
I second that.
Okay. So no smoking.
No coffee.
No coffee.
No soda pop.
Yeah, no soda.
Refined sugar, which also actually has a big effect on the collagen.
Okay.
And then once we reduce all of those, then we want to include the free radical fighting foods, the scavengers. An easy way to do that would just be to do a cup of blueberries every morning.
So something that's rich in antioxidants is what
Yes.
you're saying, to help the skin.
Yes.
What about a daily routine before I leave the house? Do you recommend applying anything to the face?
Yeah, so Ayurvedic medicine is big on the usage of oils internally and
would
externally.
That be one of them?
Yeah, this is one of them, olive oil. And the reason
just so happens she has
it just magically appeared here. And the great thing about
Now, what
using
is this?
olive
Can I see
oil, yeah.
This is olive oil?
Yeah, and the great thing about using olive oil or coconut oil, which I recommend, is that it's in your kitchen. It's so easy to use. And I recommend that you apply it at night along your wrinkle lines.
You know,
Yeah.
I'm a divorced person at 50. I'm making this up. I have kids. I want to get back there in the dating pool. What's wrong with me doing a couple of doses of Botox? It makes me feel good about myself.
And that's important.
What do you say?
There's
I'm
side
asking you.
Yeah, absolutely. So
you
there's side
say
effects
needles,
too.
no needles, or you're like, I can't talk to you anymore. What do you say? I mean, I'm being honest. Like somebody says
It
to me,
depends on how much Botox you have. You may not be
no,
able to
I've never
express.
done it before. I see Dr. Sabdani. I trust her implicitly, and I'm like, I want to do some Botox. I just want to feel good about myself.
The thing is that the wrinkles have reasons of why they're there. So if we just do
Yeah, but they're
Botox and
there
don't
because I'm
address
50.
them,
I'm not
everyone
really
has
50, but
not everyone who's 50
well,
has a
genetics
lot
plays an
of
important role,
wrinkles.
but let's face it, as
Well,
you
let's
age,
talk about the
you're
side
going
effects
to
of
get-
Botox.
All right, let's give it.
So I've had patients come to me who've had nerve damage from Botox or swelling that's lasted a really long time, allergic reaction to the Botox. And so basically,
And not to
you're
mention
putting,
some asymmetrical
can
droopiness
happen.
of the eye.
Yeah,
You
that
can
can
get it,
happen.
yes, and then you look like this all the time, like my friend
But
Eric.
that goes away. That's temporary.
So we're going back to your original comment. What's wrong with a little bit of aging versus some of these side effects that can...
I agree. I was just saying that I have
long-term.
had patients come in and say, I want to do this. What would be wrong with it? And you did mention there are side effects. Everything has side effects.
Everything has side effects, and
You
they're
know,
temporary,
even a
and they're
scalpel,
also very
there's
technique-based.
side effects with
right?
everything. So I get that. But is there something beyond these temporary side effects that you're opposed to, with Botox?
Well, I just think there's other ways that you can do it before you go to the Botox. Like there's this great collagen silica supplement that I give that
Okay.
fills out the face, and you
That
should definitely do all of the natural things. And ultimately, it's a personal decision. I'm sure
Definitely.
we'd both agree.
Yeah.
Well, thank you both very much. I learned a lot. We're going to take a break. Up next, don't give your thinning hair the brush off. It may be a sign of something more serious. Welcome back to Dueling Doctors, the show where health experts from the world of holistic, natural, and conventional Western medicine debate the best ways to treat common ailments that affect us all. Today's topic, beauty dilemmas. We're joined by New York City naturopath Dr. Karuna Subnani and more conventionally trained Dr. Shirley Madure. I love that name. We've already discussed the best ways to treat wrinkles. Now it's time to tackle thinning hair, something I hear so much about from all my patients, especially the males, including my friend Eric. Now, you lose about 50 to 100 hairs a day, but some people lose about 100,000 hairs, and that's considered like hair loss. And many factors contribute to hair loss. Genetics plays an important part, but there could be something more underlying. Each of our doctors has up to 1 minute to present a treatment plan, and then we'll discuss the pros and cons of each. Dr. Madure, you went first, so we're going to start with Dr. Subnani. Tell me about my thinning hair.
Your hair looks great,
All
by
right.
the way. We
Now
can
you're
use
my
you
new
as the
best
model.
friend, too.
So first off, thinning hair could be caused by something more serious. So I would rule out any hormonal deficiencies, iron deficiency,
Iron
thyroid
deficiency is
problems.
interesting. I would never associate typically iron deficiency with hair loss.
Yeah,
but it's true.
It's very true.
And do you or do you not need anemia associated with iron deficiency?
You don't necessarily
Doubt
need
that.
anemia. So, going with that, we would make sure that a person has all the iron-full foods in their diet. Regardless, everyone should have that fresh leafy greens, kale, spinach, all of these foods. But another big thing with thinning hair is people don't realize that these follicles are alive. The hair may be dead, the follicles are alive. So they react to stress, they react to the toxins you put in your body that you're exposed to, high sugar diets. So we want to remove those first. That's a big thing in naturopathic medicine
Is
and in
removing
Ayurvedic.
stressors from your life and keeping my follicles alive by keeping them stress-free?
Yeah, so here's something
So what
that
could I
you can
do?
do.
Yeah.
It's almost like yoga for your follicles,
Oh,
right?
I like that.
People don't realize, but you can actually visualize your scalp relaxing. Just say, scalp relax. It's one of these things.
So you're, in all seriousness, like almost like in a meditative state, saying, I want to relax. I'm visualizing my hair follicles relaxing because why? We're trying to increase the circulation of blood to the scalp?
We're trying to increase the circulation to the scalp, which is a big thing with thinning hair and hair loss. But you can also do that with yoga postures, that bring blood to the scalp. So anything that brings, blood in, like downward dog, shoulder stand, people can
Really?
look this up. But with the relaxation, you want to do it throughout the day. You
So
just
not
remind
just one
yourself.
time a day, just relax yourself. All right, Dr. Madeir.
I'm a huge fan of visualization, but I got a lot on my mind, and I'm
Tell
not
me.
trying to tell my scalp to relax. So I'm very surgical.
So how do I grow some hair?
I very much respect and agree with the good doctor is saying. I agree with taking care of all of the causative factors, managing stress, and visualizing a full head
But
of
also,
hair.
besides anemia,
Yes.
iron deficiency, you have to rule out other medical problems.
Absolutely.
Like thyroid disease.
You have to rule out thyroid disease, absolutely. You have to rule out hormonal imbalances because hormonal imbalances
Yes.
do that. So all of that aside, and once you get your checkup and everything is all good, then again, I'm very surgical about my approach. So I go straight to the secondary source, if you will. And that secondary source is the scalp. I like to consider scalp like grass. And so your lawn is going to look lovely if the soil is rich in vitamins and minerals and is healthy and is well watered and hydrated. Same with the scalp. In absence of those things, and obviously in absence of diseases, I go straight to the needle.
So what are you putting in that needle?
So I'm injecting multiple B vitamins. I'm also injecting a little vasodilator to open up the blood vessels. And I'm also, injecting other things that help to stimulate the
Can we
scalp.
do we have to get the needle out? Can we just go to minoxidil?
Yes.
Or Propecia?
And those are complementary treatments.
I prescribe Propecia a lot because it does
Understandable.
work.
Yes.
There are side effects.
There
Big
are.
time.
Do you want to jump in and tell me them, or I'll tell you?
No, I can tell you.
Okay, good.
Let me tell you.
She's all over the side effects.
So we know, like for men, it can cause erectile dysfunction.
Erectile dysfunction.
We don't need
For
that.
women, there can be some birth defects, with any children they may have. So I think,
Well, men, it's
would you
low
want it?
libido,
Yep.
even infertility, erectile dysfunction, which we do know will reverse if you stop taking it. It
Yes.
has been shown.
But
I
so
do
you're
the-
having issues with your ego, maybe that your hair's lost and now you can't get it up. There.
I think
what about
that-
minoxidil?
Yeah.
I find, and I have used it, that it is kind of gross. It oils down your face, it gives you acne, it increases your heart rate, you can have edema from it. And I know they made the foam, which I appreciate, but it's hard to get it in there. It does work, but I find it's really hard. I actually recommend that you wear a cotton headband, put it in there. What about hair transplants?
Love hair transplants.
Ooh, you should.
That's an option for a lot of men. It is surgical, however, it's not inexpensive, but it definitely is an option if you've gotten to the point where nothing else has worked or made you happy. And for hair loss, there's some new treatments on the horizon that include stem cells. You can clone your hair follicles and implant them into your scalp.
Well, before we get to that phase, how about we try a little naturopathic way by using some rosemary extract and almond oil?
Am I your new best friend now?
I am. I do. I'm doing this for you, actually.
Thank
So
you.
you mix
Thank you.
one part of each, mix it together, and you apply it directly to your scalp. You
I
recommend
wouldn't
doing
do
this?
one part of each. Rosemary oil is strong, maybe just a few drops to
Just a
almond
few
oil.
drops to
and
the
it
almond oil.
increases the circulation of the
Okay.
follicles.
I love
so
it.
back to
All right,
circulation.
a lot of good information. We're going to take a break. I'm going to have a little lunch. And when we come back, one of the least attractive ailments ever, toenail fungus. How can you kick it once and for all? I'll show you. Welcome back to Dueling Doctors, our beauty edition. Time to talk about one of the most unattractive, embarrassing beauty issues, toenail fungus. That's right, onychomycosis. That's when those dermatophytes live on your nails because it's nice and warm and moist down there by your feet. And you know what it looks like, that's it. It's yellow spots, and then before you know it, you have what looks like a burnt fingerling potato stuck onto the end of your toe. Well, each of our doctors has up to 1 minute to present a treatment plan. Dr. Madeir, tell me how to take care of my fingerling potatoes.
Thankfully, as a plastic surgeon, I do not have to deal with this often. However, if I am
cut off
neck
the toe.
off,
And I'm done.
Yeah, no toes. I don't do toes. But when my patients do complain about that, I use very traditional medications. And basically, the top oral medication or traditional one is Lamisil.
So an oral antifungal.
An oral antifungal, which is named
Lamisil.
And on top of that, I actually also prescribe a topical medication called Penlac. So it's like a nail polish that you brush on 3 times a day.
I reserve Penlac for patients who have liver problems because you cannot be on an oral antifungal because it's metabolized to the liver and it increases liver enzymes, which you have to check throughout the course.
Absolutely.
Like if you're on it for 3 to 4 months, you have to have your liver enzymes checked continuously. It's very toxic.
Very toxic to the liver, but it works.
Penlac,
not as effective as the Lamisil. However, as I'm sure we're going to talk about, treatment is very difficult, and it can take anywhere from a minimum to 6 months up to a full year to eradicate that fungus. It's funky.
What do you think about the laser treatment?
So the FDA definitely has approved of a laser, and it's a great option. However, it's not widely available.
The jury is out for me.
Yeah, what's the jury?
I've had a couple of patients do it,
and
I don't think it really works. I think let's face it, fungal and nail infections are really hard to get rid of.
Very hard.
And I think the only thing that has worked I've seen is the antifungal medication, which are something you have to really closely monitor your patients.
Indeed.
I think the Penlac is nice if you have liver problems. I think it's just like saying to your patient, here's some nail polish, be happy, get out of here. But honestly, I don't think they've perfected the laser.
Hasn't been perfected, not widely available, very expensive, less than 100% cure rates. There is a new drug that's in the works, not quite FDA approved yet, efinaconazole, yes indeed, and it's topical though, so no liver toxicity, no liver toxicity, better than Penlac reportedly by the initial study, so jury's not out yet.
All right, do you have any Ayurvedic treatments? And by the way, I know a lot of people out there, but like somebody like me, what is Ayurvedic?
With Ayurvedic medicine, we're always looking at a person's relationship to nature and using all the 5 elements. So we're not looking at the individual separately or symptoms separately from everything that's on the outside.
Well, what could be better than fungus on toes?
Exactly.
No, but that's an interesting thing. I mean, because why do people walk around barefoot?
To be one with nature.
Well, don't you think that's how you get fungal infections?
I don't think that's the only way. So, you know, my side is often with this chronic fungus, which I do agree that it's very, very hard to treat. We have to look at it as an external imbalance of something going on internally. If it's chronic, we have to do something about that. So definitely including probiotics into your diet, like some vinegar-free sauerkraut, taking a strong probiotic internally.
And also having other medical problems, like especially diabetes, make you prone to fungal infections in general. But
you want to cut out the sugars. You want to make sure you do.
Because it's a breeding ground.
And I would still probably give strong antifungal herbs internally.
So what do you recommend specifically if I have a fungal infection on my toes?
Well, let me talk about the topical ones because internally it's very specific. You know, we're not looking at the symptoms, so it's the whole person, right?
I know, whole person.
So
me and you walking around in the earth.
So there's some different ones, but I'll start with this one first, which might bring up a few things for a few people. But urine therapy. Why does it work when it works?
Urine, like in
urea.
Urine.
Yeah.
Oh, you know about this?
Totally.
Because it's an active ingredient in the medical antifungals.
So wait a minute.
And it's in your shampoo.
Do you do this like your own personal urine?
Your own personal urine, but actually,
wait a minute.
Actually, you can use anyone's urine.
Just whiz on the toes.
Yeah.
Do you sell
Whiz on your
urine
toes.
products?
I thought you were going to bring some here at the table.
No, wait.
We didn't
Can I
have
just ask you
any.
something? And I'm all serious. Are we talking about urinating on your toes in the shower? Or are we
can
talking like
urinate?
the Palmolive commercial where you're just dipping in it?
So here's the thing, you can urinate on your toes in the shower, and I read that Madonna did this to cure her
Yeah.
How frequently do you have to do this?
Well, every time you
Survivor, a
shower.
producer just told me earlier on Survivor, they did that out there in the jungle. Do like
So
that?
you urinate on your toes.
Why not do it every day? It's easy, it's free. But here, if you want to be more brave, put that stopper and soak your feet in the urine. Get some
Wow.
cotton, you have to get under there. Yeah.
Get all
I have
up
to
in
say, that is very enlightening.
Glad
and
I'm wearing yellow today.
I'm so glad you both joined me for the beauty show because you're both very beautiful. And all this great information that we learned today, I learned a lot. Coming up, my spin on beauty being more than skin deep. We'll be right back. Welcome back. You know, during the commercial break, I was wondering how many of you were urinating on your toes. We had some great information today, and here's my spin. For your skin, I would recommend drinking plenty of water and moisturizing daily. For thinning hair, you should keep your scalp clean, but to grow hair, you may need to go on an oral medication. And for toenail fungus, don't walk around barefoot. Beauty is more than skin deep, but if there is something about your appearance that bothers you, you should talk about it with your doctor. Cosmetic procedures are a personal decision, but remember, all the Botox, fillers, and liposuction in the world aren't going to make you happy if you're not happy up here. Remember, it's a scalpel, not a magic wand. I'm Dr. Frank Spinelli. Hope to see you soon for more healthy discussion as you explore the best path to your own personal prescription on Dueling Doctors. And as always, be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.